Do you have inverted nipples, and have you ever thought about if there's any possibility of getting them repaired? Well, I'm Dr. Megan Drevscrat. I'm a board certified plastic surgeon in Seattle, and today I want to talk about the surgical correction of inverted nipples. Now, before we can talk about surgery, we have to kind of define what is an inverted nipple. Well, in a normal nipple, you see it projecting outward. However, in some patients, they have more of an inversion, and whether that means that it actually just lays flat against the breast and doesn't sit three-dimensionally out, or it actually is tethered inward to create a concave appearance, either of those are considered to be an inverted nipple. When we're thinking about which surgical procedure is going to best correct this deformity, we have to think about the degree of inversion. Is the nipple very easy to get in a three-dimensional position, or is it so tethered that no matter what you do, you can't actually get it back into a more normal, regular position? I think it's best to understand surgical correction broken down into three components. The first is we want to release what is tethering the nipple. What is keeping it from being in that three-dimensional position? Typically, there's going to be kind of thicker fibers or fibrotic tissue or something at the base of the nipple that's kind of constricting it in. And so the way that we manage this is we make a small incision at the base of the nipple, we put a fine pair of scissors in, and we either actually cut those structures or we stretch them out until we can get the nipple in a more three-dimensional position. Once we've got it in the perfect position, how do we keep it there? The way that we typically do this is by narrowing the base of the nipple so that it stays in a projected position. We typically will do this with sutures that run around the base of the nipple and constrict the base. Now, you can also do that by removing a small amount of tissue, but typically we will do this by using dissolvable sutures. Lastly, if the nipple has been severely constricted, then oftentimes once we get it into that three-dimensional position, there's actually a lack of tissue bulk at the base. So long-term, it's going to tend to want to fall back down into either a flat or an inverted position again. And in those situations, what you'll want to do is take tissue from around the areola, just a small amount, and tuck it underneath the nipple so you sort of build up that foundation. Now, no surgical procedure comes without risks. The three main things that we want to think about when it comes to an inverted nipple correction is the nerves that are at risk for damage, the milk ducts that are at risk for damage, and the possibility of the nipple flattening over time. So if you guys have gotten to the end of this video and you found this helpful and educational and informative, please share. If you guys have any questions, leave them in the comments below.